COVID-19 pandemic. My name is Vivian Kai. Look, in a bit, we'll give you the latest on this pandemic as regards with Ghana, and then we'll also have a look at the global outlook and many other things that have come up from today's press conference organized by the Information Ministry, giving us the latest on our story here in Ghana. Stay with us, we'll be right back. So welcome back to a special coverage of the COVID-19 pandemic. My name is Vivian Kai. Let me introduce the two gentlemen I'll be having today's discussion with. I have Bernard Avle. He's with Citi FM and Citi TV. Welcome, Bernard.
Thank you, Vivian.
I also have Kojo Akoto Wating, also with Citi FM and Citi TV. Kojo, welcome.
Thank you, Vivian.
Okay, great. So, gentlemen, let's start. Let's start quickly with the global outlook. Come to Africa, and then we take the Ghana story. So could you give us...
Okay, so we'll start with the global, and we'll pick from the Johns Hopkins dashboard, which is the global reference point for the numbers for COVID-19. Total confirmed cases as we speak, we are looking at 3.6 million confirmed cases. The United States alone has 1.18 million of those cases, approximately 1.2 million cases, taking about a third of the global confirmed cases. Spain follows the US with 218,000 cases. Italy is next with 211,000 cases. The United Kingdom has 191,000 cases. France, Germany, Russia, Turkey, Brazil, Iran, they follow in that order. It's interesting to note how Brazil is rising very fast in the numbers now. When we started talking about COVID-19, Brazil, even though it has a big population, and it had all the elements for a spread, we're not seeing Brazil in the numbers, but now they are testing more and they are getting more numbers. So Brazil has joined the top countries when it comes to the top 10 countries when it comes to the prevalence of COVID-19 in the countries. Now, globally, the number of people who have died from COVID-19 is 250,000. 252,000 people have died from COVID-19. In that particular chart as well, the United States leads with 69,000 people. Italy follows, and the United Kingdom is trailing Italy just by about 1,000 deaths. So United Kingdom is 28,000. And analysts are saying that if the trends in the United Kingdom continues, they may overtake.
It's actually 28,809,
yeah.
And Italy is 29,079. So it's statistically the same.
Yeah. So what the analysts are saying is that the United Kingdom could easily overtake Italy and become number 2 when it comes to the number of deaths. Spain and France are in the numbers, and Brazil, again, 7,367 people have died in Brazil. So they are about the 7th when it comes to global deaths, and they are about the 10th when it comes to global number of confirmed cases. Now, if you check recoveries globally, we have 1.175 recoveries globally. And the United States leads, Germany number 2. So look at the trends. US is leading when it comes to total confirmed cases. Germany is number 6 when it comes to global confirmed cases with 166,000 cases. But when it comes to recoveries, Germany has 135,000 cases, meaning that the recovery rate in Germany is really, really high compared to other countries. Italy, Iran, and France, Brazil are in that order, and Switzerland is also in the top countries when it comes to recoveries. So far, the number of tests conducted in the US is 7.2 million, with New York City or the New York State leading with about 1 million tests. So that's how the global outlook for COVID-19 is. Now, if we come to Africa, the Africa data, as we've put on citinewsroom.com/coronavirus, is from the Africa CDC dashboard. They are collecting data on the Africa cases, and they've categorized the cases into Northern Africa, West, Southern, Eastern, and Central. Now, In Africa, we have a total of 47,118 cases recorded so far, with 1,843 people dying and 15,587 recoveries. Okay. Now, if you check the Africa figures, the northern part of Africa is leading with about 17,700 cases, followed by Western or West Africa, 13,000 cases. Southern part of Africa, 7,700 cases. Eastern, 4,600 cases, and Central Africa, 4,100 cases. Now, when you go to the northern part of Africa, that's the region that leads. Egypt is the number one country with the most cases, 6,800 cases. 6,800 cases. But one thing which is interesting about the Southern Africa cases is that even though Southern Africa is number 3 when it comes to the regions in on the continent, and they have 7,700 cases, South Africa alone is contributing almost the 7,700. They have 7,200 cases. Okay. So South Africa has the most cases in Southern Africa. Zambia and Eswatini and the other countries follow. Now let's come home to West Africa. We have a total of 13,000 cases in West Africa. Nigeria has 2,800 cases. As at last 2 weeks, Ghana was Nigeria have 2,700 cases. It's so bad that I'm using the word trail. This is not to say it's positive. It's not. We have 2,700 cases. Guinea is next with 1,700 cases. Cote d'Ivoire 1,004, and Senegal has 1,300 cases. Wow. The case of Central Africa is still being debated. And analysts are saying, is it because they don't have as many cases, or is it because they are not testing? Because Central Africa has 4,100 cases, with Cameroon leading, DRC and Gabon follow.
And don't forget that Central Africa is where Ebola started from. And if you look at the climatic pattern in Central Africa, a lot of some of the zoonotic viruses will typically emanate from such heavy rainforest type places. So Central Africa is an interesting case.
And the other thing also with Central Africa is it's an unstable region. If you go to Cameroon, we have the government and other governments.
Yes.
So coordination of emergency strategies on a national level is not as effective as countries like Nigeria, Ghana, and the more stable countries. So that explains how Central Africa the situation is. Now, in Ghana, we have 2,719 total confirmed cases. Out of this, we've seen 294 recoveries, and 18 people have died. If you take the recoveries and the deaths from the total confirmed cases, you get the active cases, and you have 2,407. But let me note or bring to your attention that if you check the Ghana Health Service website, and if you go to previous updates, that's where they give the breakdown. They write that these are total confirmed cases of COVID-19 and treatment outcomes in Ghana as of 2nd May 2020. So even though this figure of 2,719, we got to know yesterday on the platform, the date they are assigning to this number is as of 2nd of May 2020. Okay. And per this data, the breakdown, the total recoveries is 294, and they are all from the general surveillance. The people who have recovered. Those responding to treatment, 2,402. 602 are from general surveillance. 115 are from travelers undergoing mandatory quarantine in Accra and Tamale. And 1,685 are from enhanced contact tracing. We are told that 5 people are critical or moderately ill, and they are all in the general surveillance. And 18 people have died. They are also all in the general surveillance. So the total is 2,719, and the total number of tests carried out so far is 129,461. So that's the general overview of COVID-19, world, Africa, and Ghana.
So today the Minister of Information had a presser to give us the latest on all this with regards to Ghana proper. So I'm going to pick a few of his videos. We'll look at some of them. The key things from this presser: 1, we've cleared our backlog, especially with Noguchi. KCCR is left with a few. We'll deal with that. Then also, we've reached our peak. whether that's the case or not. We'll look at that as well. And then others who have been tested already, waiting for another test, also came up. And then the issue about compliance with some of the things we put in place. So I think we should start with the testing bit, because the peak is a huge discussion. Yeah. So let's look at clearing the backlog with our testing, and go to Director of Virology at the Noguchi Memorial Institute, Professor William Ampofo. Let's have a listen to what he said.
The backlog. So I just cross-checked with Professor Richard Phillips of KCCR, and he has 1,982 samples awaiting testing. It was 3,500 yesterday, so they worked all night, and he expects that by Thursday the backlog will be done. For Noguchi, we have no backlog. There are 0 samples awaiting testing. So, as the Minister said, we should be able to provide results within 24 hours back to the Ghana Health Service when samples are received from contact tracing and also from hospital surveillance. We have expanded testing beyond Accra and Kumasi. There is testing, as you heard previously. There's limited testing in Ho at the University of Allied Health Sciences, UHAS. We're expecting a donation from the International Atomic Agency through the Ministry of Health. We hope that by next week this will be fully established, and therefore they'll be able to increase testing in Ho for the Walter region.
Okay, so that's Professor Ampofo over there talking about the fact that Noguchi, for example, has cleared its backlog. KCCR just 1,982.
Biggest headline today is from Professor Ampofo. No backlog. Wow. Why? Because every day we've come here, we said, look, we don't know when the samples were taken, therefore we can't say these are newly occurring cases. Incidence of the disease. Last week we asked what was the incidence, and he said when we clear the backlog we can know. Yeah. So when I heard this, I was like, yes, thank you, Lord. No backlog. Then he said, so today is what?
Today is the 5th, yeah.
So if they take 500 samples today from Adabraka and they put them in the system, latest Thursday, you know the results.
So sort of real-time results now.
We are now catching up. So this is very good. When they clear the KCCR backlog, when we go to the next press conference and I said, sir, please, I have a question. What is the rate of newly occurring cases? What's the incidence? Yeah. He can say, oh, on Wednesday, we took 500 samples. 2% were positive. Thursday, we took 500. 1% were positive. So it looks like the incidence is coming down. So this is a very important milestone. Critical milestone, in my view, because our testing backlog has made it difficult to make sense of the numbers. Give you an example, Vivian. I've been calculating the number of new positives since they started 19th April. Yes.
There's a lot going on.
This is the price of Wasi. No, this is, you understand this. Key points. Between 22nd and 25th April, 273 cases. I was like, hey, this is a lot. Yeah. Then the next announcement, 27th, 121 positive. I said, oh, we are winning. Then the next day, 403 said, oh, what's going on? We are losing again. Then the next announcement, 1st May, 95. I said, we are winning. Then I said, oh, okay, if the 95 comes down to something lower, we are winning. No, 550. So I was like, my graph doesn't make sense. It's just going up and up and up and up because of the backlog. Because even this 500, there's a correlation between the size of the positive and the size of the sample. So that's very clear. Yeah. So 2 things. If we will continue our aggressive contact tracing and the samples will be bigger, we will still have more positives. Because if you go into the positivity rate, routine surveillance is almost 3%. Right? Yep. So if they take 1,000 people, 30 of them will be positive. 3%. Enhanced contact tracing, positivity rate is 1.7%. So my point is that going forward, if we take huge samples, we will still have a significant of them being positive, but now we can trace the incidence. which is a very important figure. For now, we've been approximating the incidence by using the routine surveillance as some sort of the best number. So you can say the incidence is around 3%, but now we will know in real time. So I think this is beautiful. Number two, he added that apart from Noguchi clearing the backlog and KCCR with their 1,900 backlog, he also mentioned about 4 other places where they can do tests.
Testing,
Super. He mentioned UHAS in Hope. He mentioned Tamale Medical Lab, working with their vet. In fact, there are 2 in Tamale. There's one in Pont Tamale, and there's one in Tamale itself. Then he says Western Region have also started
the veterinary lab,
working with Efia and Kwanta. He didn't give us the capacity, but even if it's 200, it's beautiful.
It's great.
So you have Western Region, Volta Region, 2 in the north,
Tamale,
Ashanti, 2 in Accra. So the key question then becomes, how aggressive will our contact tracing be? Because don't forget, when you look at the increase in samples, it's not been increasing as quickly. Do you follow me? And I'll come back to this later, because now that you've cleared your backlog, you may be able to enhance your contact tracing, take bigger samples, so you can get a clearer picture quickly of who is positive. But I've looked at the trend of samples. 22nd to 25th, we had 13,000 samples. 25th to 27th, we had 6,000 samples. 27th to 28th, 7,000 samples. 28th, 3,000 samples. So it keeps vacillating. So you also need some consistency in the sampling. Okay? If you don't do that, this great feat of clearing the backlog will not benefit you much.
Really?
If you decide to only take 100 samples a day and turn it around after 24 hours and say, oh, we are only getting 30 of them who are positive, or three of them who are positive, so it's great. That's a false picture. So the clearing of backlog becomes important if the sampling becomes more representative and more aggressive.
Okay.
Then you are getting a better picture of where you are.
Okay.
So this is positive.
Okay, could you?
Yeah, I think it's positive. Like Bernard said, we've had a problem with how fast testing is being done. We've spoken to health practitioners who have told us that they send samples in and they get results after a week or 2. And sometimes, because of the capacity of their facilities, when it happens, they do not know what to do, whether to let the people go or to keep them. But now that we've cleared the backlog and we have new labs coming on stream, health practitioners should be rest assured that when they send samples in, they can get it within 24 hours so that they know how to manage the cases. If it's positive, they manage. If it's negative, they free the space for other activities. So that's one good point. The other good point is also for us to understand real-time development of COVID-19 in the country. Because the data as we have it now on the Ghana Health Service website says that even this 2719 that was released yesterday is the update as at the 2nd of May 2020. So if we've cleared the backlog, we have more labs coming on stream. I expect the test to be done faster and data to be churned out real time so that people will know how things are developing. The other thing is also, if we've cleared the backlog and we are still contact tracing, we will be able to manage cases faster in the communities where we are contact tracing. Because there are people who have told us that, well, contact tracing was done on them, their samples were taken, and they were told to just self-quarantine without anybody really monitoring them. But now if you are going to get results faster, people in that particular category, they will know their fate early enough to know what to do and what not to do. So this is good news to know that we've cleared the backlog.
What's the protocols around the testing in terms of after the testing is done, and say we do a sampling of, let's say, Teshinugwa estates, we take 2,000 samples, and there are negatives and positives. Do we reach out to those people, or we just leave it? Just the negatives we get to?
So that question was asked twice. Initially, it was asked at a press conference last week. And what Kojo Ponkroma said was that because the backlog was large, they prioritized the positives. So if they take 3 of us, and I'm not saying you are positive, but let's assume you are the one who's positive and we are negative. Because they don't have...
to say you are positive and I'm negative, Bernard.
So they will call you first and say you are positive.
Okay.
Because they don't want you to infect somebody. These 2 people are negative, so they are not dangerous. So because they are under so much pressure, they will not contact these guys. This is what Kumi Abwajis hinted, he didn't actually say it clear, but he hinted that because of the pressure we work under, or they work under, they prioritize the positives. This is the message they've been saying. So a lot of people are asking, how come they've not contacted me? And you've cleared your backlog.
Exactly. So is that to mean that those who were tested among these huge numbers, if you've not been contacted and you know your samples went to Noguchi, you are negative?
You can make that deduction.
Okay.
I cannot state that for a fact,
okay,
because they haven't told us how long it takes to call people. But I would imagine that if you've tested somebody and you haven't held the person in quarantine, the person is roaming around town, and the person is positive, your priority is to reach him. If after 2 weeks you haven't reached the person, then means you are being irresponsible.
Yeah.
So we can make that deduction. So I think that one, they have to answer. I think this question has been asked many times. And they keep saying that because of the pressure. And don't forget, contact tracing, there are teams going out, and then these are the same people who have to call because they take your phone number and all this. So look, we can deduce from what they've said that if you haven't been contacted after a certain period of time, you are probably not positive.
Okay, let's go to the second test results. That's another issue with the test. So we clear the test, then we'll move to the other thing. So let's take a quick video from Dr. Patrick Abwachi, who is the Director General of the Ghana Health Service, on that, and then we'll look at that.
Currently, we have about 294 of the patients who have recovered after testing negative on 2 consecutive times, and we currently have more than 200 patients awaiting their second negative test so that they can also be declared recovered on discharge. One of the key areas of intervention is isolation, where people who are positive, who have are asymptomatic and do not have any underlying conditions, are either managed at home or sent to an isolation center. Currently, for our isolation center, we have 453 patients across the country in various isolation centers. 339 are in Accra. We have 85 in Eastern Region and about 9 in Ashanti. Others have a few numbers isolated currently. Last week, we want to thank UNFPA, also donated some toiletries and T-shirts for the inmates at the place. So in all this, what is the risk? This 2,719 has come out of our 129,461 tests.
So Dr. Patrick Abwachi, Director General of the Ghana Health Service. So over 200 people tested. They've done the first negative. Hopefully, if they do another negative, our recoveries are going to be good.
Yeah, the recoveries are going to be good.
Don't be so sure, because the recovery... No, let me explain. You see, this is not the first time they tell us that there's a group of people who have done one test who will come. And they will be positive. They will be negative. But the thing is that your recovery rate is a percentage of your total cases who have recovered. Okay, if by the time they do their second test, the number of cases, because we are now 2,700.
Yeah.
I have people who are projected that by end of the week will reach 3,500. So let's assume even these 200 people all test negative.
Yeah.
So your total positive is 4,490. If your overall number of cases is upwards of 3,500. Your percentage recovery hasn't changed much. So I think it's the rate of the recovery, not the numbers. The raw numbers, because every country has people who have recovered. So if the percentage moves, it's been stubbornly at 10% for a long time. Right? If you added the 200 to this 294, and the total figure was just 2,700, then you could have said we are moving up. But based on some of the projections people have made, we pray that we don't have another 500 cases by the time these 200 people recover, to keep our percentage low.
Could you share the same,
Well, I share a bit of the same, and a bit of my hopeful side is also coming to play here. Because if you look at our cases, if you check even as at last month around the same time, today is the 5th, right? As at last month around the same time, we had about 313 cases. Okay, and went up to 408, and about 2 or so weeks ago we had over 1,000 cases, and we've had a big number of people who are responding to treatment.
Yeah.
Yesterday, Kolebu released a statement that all their cases had been discharged. And 200 people have been tested and they are negative. So one of their legs are outside, and then they have another in, which hopefully will come out. And because we do not have a lot of pressure on the labs, I believe that the other negative tests can be done immediately for us to see the results. So within the next 24 hours, we should be seeing an extra 200 recoveries based on what he said. Now, all the cases recorded 2-3 weeks ago, because most of them were responding to treatment, and our doctors are coming to terms with how to manage these cases very well. I want to be hopeful that we'll see more recoveries going forward. And so that's where my hope is. But where I agree with Bernard is also to do with the enhanced contact tracing, which is still ongoing. If we are contact tracing and we are testing more, and people are not abiding by the protocols, and look, today I was in a bank. I'm not going to mention the name of the bank, but I've sent a message to their top hierarchy. 2 bank tellers, one doesn't have a face mask, the other one has it and it's on the chin.
I don't know this fixation of putting it on the chin.
Security men didn't have face masks, right? And the people in the banking space, some of them were wearing the mask, some of them were wearing it anyhow. They had the sign, no mask, no. They had the sign, no mask, but they were not wearing the mask properly. So I had to take some time to educate them. So some people feel we are getting back to business as usual, and that's where the threat is. That's where my fear is. So I'm hopeful that we are going to see more recoveries, but I'm also afraid that if people do not do the right thing, there may be spread in some communities. For example, we've heard stories of contact tracing teams going to certain communities where they were prevented from doing the contact tracing. Now, should we have a case in that particular community and these people are preventing contact tracing teams from testing, and taking the right precautions, we could see incidents of spread in those communities. So recoveries, yes, I'm hopeful we are going to see more recoveries, but I'm also afraid that people are not doing the right thing and may throw out, manage that particular side of our fight.
So we'll take a quick break. When we come back, we'll look at whether we've reached our peak in terms of this pandemic as announced to us today by the authorities. So stay with us, we'll be right back.
Hello to the youth out there. My name is Mahamudu Bawumia, Vice President of the Republic. I would like to talk to you about the coronavirus pandemic that we are dealing with at the moment. It is a virus that has infected over 1.7 million people worldwide, and over 107,000 people have died from it. It is a virus that is transmitted either through touching somebody, shaking their hands, that they can transmit the virus if they are positive, or through sneezing, coughing, that can bring out droplets, which can touch you. So this is how it is generally transmitted. And because of that, we have the science telling us that we should try and maintain distances between people, 1 meter to 2 meters of distances, so that the droplets will not be able to travel very far. It is therefore very important that we follow the instructions that have been given to all of us. Minimize or don't shake anybody's hands.
So welcome back to our special coverage of the COVID-19 pandemic. My name is Vivian Kailoko. I'm here with Bernard Avle and Kojo Akoto-Boateng. So, gentlemen, let's go to the issue about us reaching our peak in terms of infections. And the Ghana Health Service has been speaking. Its Director of Public Health, Dr. Bedusa Akodie, has been telling us what that means. Let's take that video quickly and come back.
If you look at how Ghana started attacking the virus, waiting not to chase the virus, but then face it directly by doing enhanced contact tracing. There are a lot of people that we tested that were not having symptoms. So if we are using the daily case incident with the signs and symptoms, then that will have a challenge. So clearly, the best data that we are using for this bell-shaped curve is the use of data from the date samples were tested. So where we are now, we started having a build. The first confirmed case in the country was on the 12th of March. So then those were from the people that we put together later, those that were put on quarantine. Out of the 1,030, in a short time, we had 115 of them. Those inquiring at Accra here and also internally. So we realized that with a sharp rise, and now with the cases that we are tested, clearly we seem as a country to be on top of the peak, and we are at a stage to decline. That is the observation now. The declination will depend on how we adhere to the various preventive etiquettes that have been enumerated.
So that's Dr. Bedusa Akodie. He's the Director of Public Health at the Ghana Health Service. Kojo, we are at our peak.
Yes, that's what Dr. Bedusa Akodie is saying. And based on the data available, which is as at 2nd of May 2020, 2,719, it means that when new reporting comes, we are going to see fewer active cases, more recoveries, and related positive numbers. Yeah. So if he's saying we're at our peak, maybe based on the data they have, that is it. But then if you followed any of the data sets that countries are using, WHO is using, and other institutions are using, if a country gets to its peak, you see that the curve starts falling.
Yeah.
Now, what we've seen over the years since we started reporting on COVID-19, it's been going up, and we are now at the highest peak based on the data we have. And the last report we had saw our highest number of new daily cases, which is 550. Previously it was 403. So if you're at our peak, some inferences can be made that new daily cases are dropping. We are seeing more recoveries, and the figures they have from the 3rd and the 4th, because that is data that we don't have. The data they've put out, they've dated it to the 2nd of May. So the figures they have from the 3rd and the 4th is showing a decline. If our producers would do us the favor of putting this graph on before we go any further. We plotted the COVID-19 cases based on the updates from the Ghana Health Service on our website, citinewsroom.com/coronavirus.
Okay, we'll come up with
and
it.
We did the trend of active cases. Now, when you look at it, it's going up and up.
So the bottom right.
Let's scroll down.
Okay.
Let's scroll down. We just put a specific chart up to see how.
Yes.
That's it.
So if you look at it, the one on your left is showing the trend of active cases, and the one on the right is showing confirmed cases, recoveries, deaths, and active cases. So if we're at our peak now, the next set of reporting data should see this chart coming down.
Yeah.
We should also be seeing the green, okay, the yellow, which is the recoveries, going up, to show that we're having fewer active cases. So that red line that you see there should also be coming down. And the chart on the left, the new daily cases. Now the highest peak is the last one we are seeing, which is 550. If you're reporting any new daily cases, the number should also be down.
That's right.
You understand? The moment we start seeing the curve taking that
then
trajectory,
we can really
then we can see. I want to use the Ireland reporting to give viewers and listeners a better perspective of what we mean when a country gets to its peak and when it starts falling. Now, if you check covid.is/data, which we'll put on the screen as well, they started reporting and the curve started going up. It started going up. So the
Iceland, not Ireland.
Sorry, Iceland. The two countries always confuse me. Now the blue is the number of infections, and the orange is recoveries. So when they started reporting, you look at the data, and it's blue throughout, because they have not seen any recoveries. And then they started reporting the recoveries. So gradually.
So basically, when you hit the peak of your normal distribution blue, the orange begins to increase.
Yes.
And the length of the orange becomes longer than the blue. The further to the right you go to, the blue becomes, it slows downwards, which means, you see, now what is confusing about what the professor has taken about, Dr. Edu said is, you haven't shown us any graph. The latest increase in your cases is higher than the previous one. And basic graph work, if your next announcement is higher than your previous, it means the curve is still going up. Do you understand me? If your marginal is bigger than your previous, it means your average is going up. So he hasn't provided evidence to show we hit our peak. So because if the next few new positives are lower than 550, do you understand me? Based on the same sample, then you can say we have hit the 550 is the peak. But if next week they said we have another 200 or 700 cases, then don't forget somebody has projected that based on the slope of the gradient we had, we will get to 3,500 by Friday. Okay, so I wish he has shown us the graph, because again, when you watch most press conferences, when they say they've hit the peak, they actually show a chart.
And there is consistent data.
So I don't know.
Not just one-time data to show that there's a change.
That up till now, your numbers have been based on backlogs. It's only today that you say you've cleared your backlog. So how are you knowing your new cases to say you've reached your peak? Do you get me? I don't understand how you can get to a peak.
So this is what you did. You spoke to Dr. Theo Champo, an economist, who went around the figures and gave us some idea of what it means, what they're saying. Let's watch that video. Then we'll take some more comments from you guys.
The other number you are looking at is the so-called R0, which is essentially how many people each infected person is likely to infect. I have struggled to calculate that here. I have no idea how they are working and what figure they are using. I noticed you and a colleague have said it's between 2.5 to 2.9-ish. How did you come by that? And what does that mean if you have an R0 of around 2.6?
Well, the other colleague, he's kind of done some crude approximation or estimations. I have started playing around with the R0 numbers. For me, it's been a bit difficult to calculate myself because of like the pattern in the data. So what I have actually been doing really is making inference to some of the published, literature. So you look at the scientific literature, you look at the, statistical literature, especially on COVID, and then you ask yourself, okay, for a country the size of Ghana and with sort of the characteristics, what would be a likely R0 sort of estimate, be like? And if you compare that to like Egypt or to South Africa or to Italy, UK, it's a bit different because they have different social dynamics there, but in the literature, most of the modeling work that's been done is being done with the R0 between 2 and 3, and an average of about 2.5 thereabout. And I've seen some numbers being bandied around of Ghana's R0 being 2.7, 2.8, 2.9. Personally, for me, it's been a bit difficult to estimate. So at the moment, you can build the model and you can input different R0 values in there, and then it will actually simulate how many cases, based on the infection or the reproduction number you're likely, to get, But I think the R naught is key to our understanding of the evolution of the disease. But I think what is also more important is, the R naught doesn't stand on its own. You need to connect it to a wider, epidemiological, model to now actually simulate how many people will get the disease, and how many would recover as well.
If you look at countries that have lifted restrictions, they've been very clear in what science parameter they are using. So, for example, Germany, at the time they announced they were opening primary schools sometime this week, they said their R naught was 0.7. That means that for
which is fantastic. You need it below 1.
Exactly. Right. We've read about Austria, where they took a national sample to look at prevalence, a national representative sample, and the figure they got was below 1. So they said, look, it looks like we are winning this war. My challenge is that if our R naught is 2.5, and if our incidence rate based on just the routine surveillance is trending upwards, it suggests that you are still at a very lower part of your curve. You haven't peaked, neither have you started coming down. So how do you ease restrictions when the math is suggesting that this is actually growing?
Yeah, I mean, I agree with you. I think the easing of the restrictions was more socioeconomic driven rather than the hardcore sort of scientific basis. I mean, that's clear. So, I mean, without even estimating the R naught, if we just even look at the positivity rates, to borrow Ghana Health Services own numbers, clearly the numbers have jumped from 2.2 something to 2.98, now. And if you look at the curve again, just observing the curve, no statistical exercise, you can also see, the rate of change increasing over time. So that clearly indicates to you that we're nowhere near the peak of the crisis. If they were to go out and do more testing, they will actually pick up more cases. So I don't think that the easing of the restrictions from where I sit was necessarily, driven entirely by the science, qua science, but there were other socioeconomic, considerations. And as I've said, in most of the sub-Saharan African countries, Ghana is not an exception. It's hard to actually lock down people for 3 to 4 weeks without providing any mitigating measures, and meeting their needs. Because then you're talking about riots, social unrest, protests, and the economy has to run. And I suspect what also informed the decision to lift the restrictions on our part partly was driven by the fact that, yes, we have a relatively kind of lower mortality rate as compared to some of the other countries. So even if you have more positive cases and you don't necessarily have a lot more people, quote unquote, dying, then you have to make that sort of economic kind of trade-off, to say, okay, what do you do in this instance? The last point to that really is that, okay, we have now seen an increase in the trend of the positive cases. But for me, one case is even worrying because our health resources are already overstretched, one, and number two, if you now begin to see the case or the virus moving from Accra to some of the hinterlands and some of the peri-urban, areas where already sometimes getting even malaria medication is a problem, then we're talking about a different kettle of fish, kind of like entirely. So, I mean, I understand why they might have lifted the restrictions from an economic point of view. After all, I'm an economist. But I still think that we now have to go back and look at the numbers and see, okay, is there potential for us to impose some sort of restrictions on a community basis? So basically, if you do the sampling and you see the cases picking up in certain communities or clusters, things like that, then, you may want to then kind of restrict movement in those communities in an attempt to kind of control the spread. Because the moment it begins to move out of Accra, so at the moment, over 80% of the cases are still in Accra. And even in Accra, we are seeing the thing moving into the densely populated parts. So how much more moving into, my village of Ejumako or some of the other districts where getting, anti-malaria medication or some of the, medical kits, right, to deal with the disease may be an issue.
But my final point, we know that disease occurrence is not a random thing. You can actually plot it on a curve based on the behavior of epidemics. So that's my first assumption. So it's plottable. Number two, we've had at least 7 weeks worth of tests and results. Okay, so that's point number two. And point number three, we can measure the gradient of our curve, which looks steep. So here are my questions. We talk of flattening the curve. If your gradient is steep, it doesn't suggest that you are flattening any curve. That's number one. Second point, do you have a model that can predict the peak? Because from what you've plotted, I can see maybe 2/3 of a normal distribution curve. So I'm assuming you can project where you are getting to the peak and then you start coming down. So first question is about the issue of the steepening of our gradient vis-a-vis the so-called flattening of the curve. And then number two, whether you have any model that can predict when we will hit our peak. Because if you are using the S-curve, that's the asymptote. But if you're using the normal distribution, that's your peak. The question is, at what point are you predicting we'll get to the peak? Then we can begin.
It's a hard question.
The 2-in-1.
I know the peak where I can start from the latter, because that's something that I'm working with some guys on to actually. Okay. So we're actually building we just started discussions to build a proper SEIR model. So basically, it's an epidemiological model, and they are like health experts, and I'm only coming in to support them on the kind of a statistical, mathematical, side of things. I think that's the only way we can properly and accurately predict where or when the peak is likely to be. Using the trend line, that I fitted and all of that, we can play around with that and make some assumptions. But at the moment, I only have the forecast going up to just like 10 days. I haven't extended it beyond that because also the data is kind of changing. And if you took the data in chunks, in some instances you see it coming up and it looks like we've reached the peak, right? And then it goes back up again, and then you can actually see like 3 of such episodes in the data. Hence why I suspect people in the health service saying, "Oh, we've reached our peak," was it like 2 or 3 weeks ago, and then suddenly, But we also forget that there's a backlog. Then there was a backlog in the cases and all of that, so it was a bit premature to say we are at the peak. What I can clearly tell you, is that we are not at our peak. I don't think we're at our peak yet. I still think we have a couple of days, if not weeks, to go. But I cannot give you an exact figure. Also because we actually would need a proper, epidemiological model to actually kind of, do that at the moment.
But you agree with me that our curve is not flattening based on the slope?
Of course, it's not. It's not. You can see the slope clearly. It's not flattening. It's going up and going up. So what would be important now really would be okay. The next 3 of.
Right. So very interesting thoughts from Dr. Echampo, who believes we've not reached our peak.
Let me issue a caveat. He's not an epidemiologist. So he's using the data the Ghana Health Service has put out, and he's plotting a curve as a statistician and an economist. So usually you have this is very interdisciplinary, right? So you have epidemiologists who have a more realistic assumption and information about disease incidence, disease burden, and all those things. That's why he says that they are working with epidemiologists. But just purely from pure mathematics, it will be very difficult to agree that our curve has peaked. Because a normal distribution, you see, the point he makes is important. Diseases are not random. A normal distribution curve means it starts, it gets to a certain, and then comes down. Okay. If it's flatter, it's quick, or it can be steep. Okay. It will be the same volume, but so the reason for this social distancing is that you can start, and it will take a longer time to get to your peak, and the peak will be lower, so your hospital can match it. So mathematically, based on the figures they are giving us, it's very difficult to really get into our peak. But we need to admit that because some of these figures have included backlogs, it's giving a false picture of the daily new cases, right? So now, following today, I think if we got 1 or 2 weeks worth of data on the basis of daily or every 2 days in real time, then you can actually know where you are. So, which is why I'm surprised he didn't show us any curve. And he didn't tell us. I mean, it's look, he probably has more information, right? But I'm just from pure statistics. It's difficult to believe that you've gotten to your peak. But this projection is not just a statistical thing. There are also other disease issues. So we are prepared to hold plays out. Do you follow me? So I will not insist too much. But from the way the graph is behaving, it's very difficult to believe we've reached our peak.
For you? Yeah, and like I said earlier, the figures that we are working with now from the Ghana Health Service portal, this portal suggests that these are the figures as at the 2nd of May 2020. And today is the 5th of May. And he said we had reached our peak. So it's possible that what they've recorded on the 3rd and the 4th, which they have not put out, is showing a decline. Even that it is more realistic and more practical to see these figures come within a period of time. Show a trend of consistent drop.
2 days is just to...
Yes, because data we've seen elsewhere, there are certain places where at a point they were up like that and it dropped for a couple of days and then went up. They didn't announce that they had reached their peak till they waited and saw consistent information over a period of time, which showed the number of cases coming down, number of recoveries going up, before they confidently said they were at their peak. But what we've seen so far, all the updates we've seen since we started reporting COVID-19 cases have been going up. And the past 2 weeks, for instance, we've seen over 1,000 confirmed cases within the past 2 weeks. We have not seen any new figures to suggest that our number of cases are coming down. Also, because we've plotted the active cases chart, that is not also giving us any indication that it's coming down. For example, if our number of cumulative confirmed cases, 2719, was still even going up, maybe it hit, say, 3,000, and then our recoveries hit, say, 1,000, we would have the active case charts coming down, which will give us an indication that the burden on the healthcare system is reducing. So we are managing something. So for me, I'll wait till about next week, next 2 weeks, next 3 weeks to see the trends before we can really say that we are at our peak. Also, because we are not the people collecting the data, and data sets we've seen suggest that they are collecting much more information than they are putting out, I'll defer to him for now. But the next few sets of announcements will confirm or corroborate what he said earlier today, that we've reached our peak. So I'm happy if we've reached our peak. It means that very soon we'll be getting out of the woods. More recoveries, fewer cases, life will be getting back to normal. So I'm happy if it's indeed the case. But we wait for the data as they'll release in the coming days to corroborate what they've said this morning.
So let's take a few messages. We have some few minutes to wrap up. This one from Bright. Problematic. The heat map is supposed to have the heat concentrated at the epicenter and spreading out, but what you rather see is the heat at the regional capitals. In Volta, for example, the epicenter is Aflao, but on the map, the heat is in Ho. Then this one says, this is from Pasolo Domain Crow. Greetings, Team Citi. Please, what about the unreported new cases in the populace? Is Ghana warming up for a total lockdown? I don't know why.
Well, if I understand this question, maybe the person is referring to the cases where Ghana Health Service reports a certain case for a region, and then we see a press release from the region saying they have more cases. What we've seen is that with time they add those cases, or they regularize the numbers, so they add them. So as time goes on, we'll see what comes out of that as well.
Okay, we're also picking up some reports that 12 out of the 16 COVID-19 patients receiving treatment in the northern region have recovered. So the numbers are, but we don't know whether it's part of the 200. We are waiting the second results to do that. But I would play quickly the Minister of Health, who is not happy with the way we are complying with the wearing
masks. Meanwhile, some of us are selling the masks by the roadside, and it is not very, very, very expensive. But I know even if it's 1 cedi, some of us will not have money to buy. So those of us who have a little extra, more than 1 cedi, when you buy one with your 2 cedi, buy one for your next neighbor. That has been the Ghanaian way of life. We support each other. And I'm pleading with companies, organizations, churches, those who have. There are those of us who don't have. We need some to wear so that the president will know we are listening to his advice. So the idea of I don't have money to buy should not be an excuse to end up from anybody. We see people in the middle of the street begging for money. So that money you are begging for, use some to buy the mask.
Okay, so let's help each other buy the mask. And then
there's a quick point. When you listen to Ajima Menu, he sounds a bit frustrated that people are not wearing the mask, because and see, Bedu Sarkodie said something. He said, we seem to be on top of the graph. The decline will depend on how we behave. All these models depend on human behavior. The Minister of Health chose to start the press conference by emphasizing behavioral improvement. That tells me that even if we are at the peak and people don't wear their masks, maintain social distancing, we can have another spike. So I want to urge the public to really take this seriously. And you see, the other point is that for Ghana Health Service Head of Public Affairs to be sounding, oh, we are at our peak, things are going to come down. In Siasari says, oh, we did a lot of... The message is confusing, because see, once you tell people that everything is okay, they lose that. Between the time we lifted the lockdown and today, people are not obeying. So I think it's better to tell people that, look, we are not yet there. Let's behave right. And when we are there, we can all rejoice. Okay, that's what I think, but what do I know?
Okay, so I have to wrap up. Thank you very much, guys. Bernard Avle and Kujo Akoto Boateng. My name is Vivian Kai Loco. Make sure if you're stepping out, you wear your mask and practice social distancing. Thank you so much for joining us. Goodbye.